Hello, my name is Susan Blank, and I'm a doctor who works with the Virginia Department of Health. Thank you for joining me for this learning session, which is part of the Virginia Healthy Hearts Initiative. Our topic for today is how to get the most out of your doctor's visit. And the advice that I'll be sharing is applicable not just for doctor's visits, but for visits with any kind of healthcare provider. Over the years, medical appointments have gotten shorter and shorter, which has led to many of them feeling rushed and a lot of frustration on the part of not just patients, but also providers, because we all share the same goal. By the end of a visit, we want to make sure that there is a good plan in place and that all of the patient's concerns and questions have been addressed. And there are a few things that you can do on the patient side to make your appointment as productive as possible and to make sure that that goal is met. And that's what we're going to be talking about today. Let's get started. We're going to start by talking about a few things that you can do before the visit. The first is to make a list of the questions or topics that you want to discuss with your provider. You can put these in a notebook or on your phone in the Notes app. You may want to sit down and do this all at once the day before the visit, but I also find it helpful personally to keep a running list and just jot things down as I think of them between visits. That way I make sure that I don't forget anything. If you have more than a few things on the list, you want to prioritize them in order of importance. That way, if you do start running short on time, you can make sure that you have addressed the most critical issues. If you're concerned about a new symptom, it can be really helpful to track that symptom and write down some notes so that you can provide helpful information for your provider. And there's some questions that you may want to consider as you're thinking about this. When did the symptom start? When and under what circumstances do you have this symptom? How severe is it? How is it affecting your life? Is there anything that seems to make the symptom better or worse? And how has the symptom changed over time? Another thing that can be very helpful to do before the visit is to make an up-to-date list of all of your medications and how you're currently taking them. And on that list, you want to include not just prescription medications, but any over-the-counter medications, vitamins, or supplements that you're taking regularly. If you prefer not to make the list or you're confused about how you should be taking your medications, an alternative is to put all of your prescription medications along with any vitamins or supplements in a bag and bring them with you to the visit so that you can go over them with your provider. You should fill out any forms that are available in advance, either written forms that are mailed to you or ones that are available on the patient portal. This allows you to do them in a calm, unrushed setting where you can focus and look up information if you need to. And you may want to consider inviting a support person, like a friend or family member. This can be really nice. It can provide you company and moral support and an extra set of ears. If you do this, it's important to discuss your expectations with that person ahead of time so they know how they can best support you. Do you want them just to be there for company? Do you want them to take notes? Are you okay if they interject and add questions? This next step isn't necessary for everyone, but if you have a complicated medical history, as many of us do as we get older, it can be very helpful to put together a medical file that you can bring with you to visits, especially with new providers. This requires a little upfront work, but it can be really helpful to make sure that your providers have a comprehensive overview of your health history, and it can also keep you from having to repeat the same things over and over again to different providers. Some things that you might want to include in this would be a list of your active medical problems, a list of hospitalizations, surgeries, your family history, an up-to-date list of medications, allergies, and copies of important test results. And once you have this put together, you want to update it periodically to make sure that any new problems or medications are added. On the day of the visit, you want to gather together any information that you need to bring with you to the visit. This includes your insurance card, a photo ID, a form of payment if you have a copay. It can also be a good idea to call in advance to find out what your copay is and what options there may be for financial assistance if you need it. You should bring your list of questions and medications that you made, and don't forget to bring your hearing aids or glasses if you use them. You want to try to arrive around 15 minutes early for the appointment. This allows you to be fully checked in by the time of the appointment and maximizes your time with your provider. And be sure to plan sufficient time for parking and getting to the office, especially if it's an office that you haven't been to before or if you have mobility issues. I know it can be a little annoying to get there early for appointments, especially if your provider tends to run behind, but this really is the best way to ensure that everybody is able to stay on schedule. One patient showing up late can throw off the schedule for everyone else for the rest of the day. Now we're going to move on and discuss some general tips for while you're at your visit. The first is to always be honest. It's really important that you're honest with your doctor about whether or not you're taking your medications as directed, if you're drinking alcohol, doing drugs, whether or not you're exercising. We can't help you if we don't know what's going on with you. And sometimes a lack of honesty can be life-threatening. I'm a diabetes doctor, and I've seen multiple people over the years who have ended up with severely low blood sugars because they haven't been honest with their doctor about whether or not they were taking their insulin. They told their doctor that they were taking the insulin or led them to believe that when they weren't, and so they continued to have high blood sugars. The doctor kept increasing and increasing the insulin dose, and eventually the person will end up in the hospital because of an emergency or because they need a surgery, and someone will give them the dose of insulin that's in their chart, which they haven't been taking, and it will be way too much, and they can end up with a life-threatening low blood sugar. So it's important to always be honest. The next is don't be embarrassed. By the time people have made it through their medical training, we have heard everything, and I promise you that there is nothing that you can tell us that is going to shock or embarrass us. So just be honest and upfront. And also always advocate for yourself and your health. This is your appointment, so speak up, raise your concerns, ask questions if you need clarification or you don't understand something. As far as specific tips for during the visit, share your questions and your concerns with your provider. If you have multiple issues, it's also helpful to share your priorities. If you can't get to all of them within a single visit, request a follow-up visit so you can continue the conversation. Share any important updates since your last visit. So these would be things like hospitalizations, surgeries, changes in your medications, major life events. Ask for clarification if needed. Don't hesitate to ask a provider to define a term that you don't understand, or to spell out the name of a medication, or to repeat important instructions. And it can be helpful to take notes on important points so that you don't forget them after the visit. There are some specific things that you may want to address during the visit if you're concerned about heart health. The first is that you should know your numbers, and specifically what are known as the ABCs of heart health. The A stands for hemoglobin A1C, which looks at your average blood sugar over time and is a blood test that's used to assess your risk of diabetes or how well your diabetes is controlled if you do have diabetes. The B stands for blood pressure, and the C stands for cholesterol. So these are numbers that you may want to ask your provider about and also understand from them what they say about your risk for heart disease. Another question to ask is, what is my overall cardiovascular risk? Doctors can estimate this using tools like the American Heart Association Prevent Calculator and share those results with you. And another question to ask is, what can I do to reduce my risk? At the end of the visit, especially if you've been discussing complicated topics, it can be very helpful to check your own understanding by summarizing and repeating back important points in your own words. You also want to confirm next steps, and what this is going to look like will depend a little bit on what has happened during the visit. If you've been prescribed new medications, you want to understand how quickly to expect the medications to work and what side effects you should be on the lookout for. If tests have been ordered, you want to understand when and how to expect to get the results back, and you should know the plan for follow-up. You should also feel free to ask for written instructions, a visit summary, and copies of important tests if you want them. After the visit, of course, it's important to follow your provider's instructions. There are also some circumstances in which case it might be necessary to communicate with your provider even before the next visit, either by phone or through a patient portal. These would include if you have any issues with cost or side effects from new medications that were prescribed, or if the symptoms that you are having are numbers that you're monitoring at home, including blood pressure and blood sugars, either aren't improving or are getting worse despite treatment. This concludes today's session. Thank you very much for your time and attention. I hope you've learned some helpful tips that will help you make the most out of future doctor's visits. If you're interested in more information on heart health, I've included the address for the VDH website along with a QR code that will take you there. Thank you and have a wonderful day.